Hey, SITC fam. If you like what you're hearing, don't forget to rate us 5 stars on any podcast platform. Leave us a review wherever you can. And don't forget to subscribe to LL Giselle on YouTube. Follow us on Instagram and find us on Facebook at Sonographers in the Cities. Hey everyone, welcome to another episode of Sonographers in the Cities. I'm Giselle.
And I'm Lynn.
Happy New Year! It's the first episode of 2023, and today we are starting the new year with bringing a very important topic to the table, and that is talking all about ultrasound, sonography, ultrasound technologist, sonographer. What is all of that? And we're going to talk about what is diagnostic medical sonography, aka ultrasound. So yeah, welcome.
Yes, welcome. We actually did our first episode ever of the podcast on this. And now that we are a little bit into the groove of podcasting, we thought we could redo this episode, vamped it up. And now that I am a sonographer, maybe there'll be an updated view for this on my end, but we'll see.
Yeah, you guys should definitely go check out episode number 1. If you haven't yet, Lynn was just a student. That was back in October of 2020. Jeez,
2021.
2021?
Yes.
October 2021.
It's
Jeez.
2023 now.
2023? Oh
Yes.
my gosh, the time is just, it's crazy.
Yes.
But if
So
you
back in
guys,
October 2021, I was
yeah,
actually listening to the episode.
yes.
I said that I was an ecovascular student. I sounded
Yeah.
very, very new.
Go listen to it and
And
see.
I don't know if you can tolerate the, the
Sound.
sounds that
Mhm.
we were experimenting. Hopefully this episode will be better
Yeah, much
than
better,
the
I'm
first
sure.
one.
But it was a very good episode.
Yes.
The stuff is still the same, and ultrasound will, as technology grows, ultrasound will still be the same for now. And everything we spoke about in that episode, great information. We're just going to talk about it again in this episode, probably more stuff, add new stuff. Now, today, we actually have the ARDMS website pulled up. So Lynn can tell us what it actually says about ultrasound.
Yes. I go now.
Yeah.
Yeah. Okay. So, what is sonography? Sonography or ultrasound is a non-invasive diagnostic medical imaging procedure that uses sound waves to visualize organs or systems in the body. Ultrasound or sonography, as everyone knows, they would refer to them as babies, where we scan, check for babies, but it is not just that because we do ultrasound on every single part of the body.
Yeah. So, for those who don't know and are listening to us for the very first time, welcome. Obviously, we love having you guys here. We talk about ultrasound and we spread ultrasound awareness. And a lot of people think babies, number one, when they think of ultrasound. Also, people don't know ultrasound is also known as sonography. So they're used interchangeably. And we had a conversation before about the difference between ultrasound technologist, ultrasound tech, sonographer, ultrasound technician. Lynn is very passionate about this subject. And so I'm going to hand that over to her to talk a little bit about those differences real quick.
Disclaimer, I'm passionate about it because when I first researched uh, this career before applying to my programs, I was really confused. Like I was really confused about seeing online that is ultrasound technician, and then I see technologist, and then I see sonographer. And the one time that I see the sonographer is on the ARDMS website. I was like, so I need to be a sonographer in order to do a job that's called ultrasound technician. Like, does that make sense? Like
Yeah, it's
I
confusing
it
for
it
sure.
didn't make sense to me as a prospective student. So, in my class, patient care class, we had this book. It's called Essentials of to Patient Care or something. And I said this in the episode one. Technician means someone who has 6 weeks to 6 months of training beyond high school. And obviously, with the requirements of being a registered sonographer or a vascular technologist, it goes beyond 6 months of training, as we all know, because the programs is really extensive and it's at least 2 years. And if there's a program that's 1 year, then you get like additional clinical time in there in order to sit for your registries. So I don't think, I personally don't think that we should be called technician, because the amount of effort, the amount of money, the amount of um, sweat, tears, stress that we put into our programs to sit for the registry, not just ARDMS, but also AART. It is AART, right?
ART. Mhm.
Um, to get that registry, to get that credential of being a sonographer, of being a vascular technologist. So we should be called what we earned. Like, we paid money to sit, we paid money to go to school to be qualified to sit for this registry, for this title that's required by the job that we're applying to, so that
Mhm.
we should be called what we worked hard for. So,
Therefore, sonographer.
or if you're, I don't know why vascular technologist is not vascular sonographer, but I learned that vascular technologist is technologist. So I accepted that we can be called technologists as well.
Yes. Mm-hmm.
So either sonographer or technologist is
Yes.
okay, because, you go to school for this, you stress out for it, you lose sleep over it. You deserve to
Right.
be called what you worked for.
Especially when you're registered. And my boss
Yes.
would definitely say the same thing. It's like you don't like if you're an MD, you want to be called doctor, right? So it's
Mm-hmm.
essentially the same exact thing. And we want to have that respect. I feel like there's different types of techs, technicians, and things like that. And so when you are at the grand scheme of things and looking at it, you want to be titled sonographer. And this is also something that has changed more recently over the last few years, which is what we talked about. It's kind of like when you see the older sonographers, a lot of times they're just like they don't care. They're just like, whatever, just a tech. But we're not just techs anymore. We're sonographers. We have a lot of knowledge. We do a lot of research. We know a lot of things. We know a lot more clinically and a lot of anatomy. We know a lot of things. We write paperwork. So yeah, just call yourself sonographers once you graduate and get registered because you deserve it. But that's basically what we spoke about on the first episode, and we want everyone to know the importance of that because we're spreading ultrasound awareness, sonography awareness, and we want people to know what sonographers are and what we do. Half the time, my patients don't even understand or realize, and they just love learning from me too when I speak to them about it and see if I spread it to them, they'll spread it to others and their family members and things like that. But essentially, ARDMS is right. What we do is use sound waves to take images. We're the eyes of the doctors. We do more than just taking pictures because we're also analyzing the images that we're taking at the same time. We have protocols that we have to do. We work in very high stress environments. Now that Lynn is actually out there working on the field, can you give the people a definition? Well, not definition, but like an example of like what you do on a daily basis as a sonographer or vascular technologist?
Yes. So, my current job I am just purely a vascular technologist. Quick note, my department is under a cardiac or echo department. So my badge says cardiac diagnostic technician. And it is my pet peeve. I don't like to look at my ID because it's so not in it's so incorrect. And my patient gets confused. I'm like, oh, so you do the heart because your badge says cardiac. I'm like, no, you're here for a vascular exam. It's
Mm,
like they get so confused. So I
mm,
just whenever
yeah.
they ask me that question, I was like, okay, let's just move on. So, a typical day of my for me, I work in the hospital in a vascular lab in an outpatient setting. Also, I also have the option to do inpatient because we have one room for the whole hospital. So we all rotate into inpatient. But mostly it's just outpatient. I go in, check out the patients for the day, and then um there are about 6 to 7 of us working, and we have about 45 to 50 patients per day. So we would all just take turns depending on who shows up. And the exams that I do are carotids. I'm trying to go down upper extremity arterioles and veins, abdominal, which includes aorta, renal, IVC, and then lower extremities is lower extremity veins, arteries, and PVRs. And we also check for grafts, so ABFs, grafts, stents, PSAs, pseudoaneurysm checks. I
Wow, that's
think I
awesome.
think that's the most of it. We sometimes we do research too because our doctors they do research as well as they treat patients. So we do have patients that go in to do their annual routine exams for that research.
Mhm. Yeah, that's really cool because you're at a research hospital
Lab.
lab,
Yes.
vascular. And so what many people don't know is that we do that, right, as sonographers.
Yes.
And then also I do all of that, what she does, but I also do more because I'm in
Mm-hmm.
a general hospital. So like she said, she does inpatient or outpatient and she can do inpatient. The hospital that I work at is also outpatient and inpatient as well as pediatrics. So I specialize in pediatrics as well. So when you become a sonographer, or if anybody wants to become an ultrasound technologist, you can do general, which has the whole entire body, pretty much, abdomen, kidneys. That also includes OBGYN, which is pelvis, babies, pregnant women. And then also musculoskeletal, which is your muscles, your you can actually look at tendons, but some people specialize in that specifically, but that is also an option for people, as well as neurosonography, which is the brain. And well, oh, and the last thing that we didn't talk about yet is cardiac, because you can be a heart scanner or sonographer. And Lynn actually went to school for vascular and cardiac. Cardiac also is known as echo. So see how there's definitely different words that people can get confused about, but they all essentially mean the same thing. Echo, sonographer, cardiac sonographer. They're just different words for the heart. But sonographers, ultrasound technologists, do a lot of things from the head to the toe, and we just want to spread that and make sure that people who are going into this field know that there's so many different options to choose from. And it's a great career. And it's very important because we help diagnose patients. We don't specifically diagnose the patient, but we help in diagnosing the patient. And I think it's a very important job in the umbrella of radiology. So when people talk about degrees, I get this question a lot, which is like, what should I study at school? Or how do I become a sonographer? Or what's the major? Every school is different. So if you guys are looking to become a sonographer, you need to first figure out where you're going to go to school in what city, and if they offer the program. Um, do your research. And in our podcast, we always mention doing your research is like the number one important thing because you have to tailor your research to what you want to do and where you want to go. And it's really important you do that first so you don't get blindsided later, or I'm sure if you guys have listened to past episodes, you'll hear stories from other people. But it's really important to do your research before you go into this field.
Yes, definitely. And sonography or ultrasound is falls under the allied health profession. So if you're planning to attend a school and looking for majors, if they offer allied health as a major, that would be your option if you want to pursue sonography in that pathway.
Yeah.
And yeah, it's a great I love it so far,
Mhm.
and I don't regret it because each day that I do it, I'm just like I'm learning more and more. And I get to talk to the doctors more now. Like, so what do you see? Someone's like, can you confirm that this is it? I'm like, I just tell you what I see, this is your job to diagnose it.
Yeah, you're like,
And it's
that's
pretty
your
fun.
job. But I mean, now that you're here on the other end of it, it's really cool to see how much you've grown from when you were a student. So, for everyone who's listening, obviously Lynn is a shining example that you can do it too. And all you got to do is first figure out what kind of sonographer you want to be. I think it's important to do your research and see like, oh, there's actually OBGYN sonographers or vascular sonographers, cardiac sonographers, general sonographers. Some people don't like scanning legs and some people don't like scanning the heart, but how will you know
If you don't
unless,
scan
yeah. So
it,
some people get lucky, like Lynn too, who have a program that teaches like everything.
everything.
For me, I was just at UNLV and I just like hopped into the ultrasound program and I didn't know it was just general only. But my program also included vascular. Some general programs do not include vascular. So that's where you have to do your research. And you can find either an associate's or a bachelor's program for degrees. And then you can also do the certificate pathway as well to become a sonographer. And it's very important that you go through your options, see what options you have, and ardms.org is your best website to go look around and kind of figure out what you want to do.
Yes. And just know that despite doing your research and say that you really feel passionate about doing, say, general, right? And then once you learn general and you learn OB, and then you lean towards more OB. So that will happen. That might happen to you because I've seen it happen to my classmates and other people where they start in one concentration and then they learned a different one and they love it even more. So keep an open mind about that because you never know where you're going to end up.
Yeah. And it's also important there's a lot of YouTube videos out there now that show a lot about ultrasound. There's a lot of Instagram pages that really show you guys their days in their lives. And I think it's fun to watch those because you can see and get a feel of the things that they're saying and doing. I know a lot of it is like comedy almost because for us that are in the field, we know what
Mm-hmm.
it's like and like why it's funny. But then when you're like doing your research, you have to try to figure out, okay, is this something that I want to do? Because it's a lot of money to do, takes a lot of money to go through school, a lot of time and effort. It's not something that people can just like, oh, I'm gonna go to school, I'm gonna become a stenographer. Like it's a lot of hard work. And people don't know what they're getting themselves into a lot of the times. Programs are they're just very competitive because there's a lot of people who want to become sonographers as well. It's a growing field. I'm looking at this website right now that says the pay for the median annual wage for cardiovascular technologists was over 60,000 in 2021, and for general Sonographers was over 78,000 in
And this
2021.
is in the US,
Mm-hmm.
right?
Yeah. So, I mean, it's a good paying field. I mean, and a lot of times people go into healthcare for the money, but that will only get you so far because this field takes a lot of brain power. And we are not just looking at livers and just taking picture of the livers. We're actually assessing them, analyzing them. We're analyzing which way the vascular flow is going,
Mm-hmm.
if the baby has a heartbeat, if there is something wrong, and that's a lot of pressure to have under your belt. So just think about those things. Being a sonographer is very important. And that's why Lynn and I are here to help everybody on their journeys and
Yeah.
spread ultrasound awareness. And yeah, is there anything else that you want to say about ultrasound and why it's important?
Ultrasound is important because you will encounter it one way or another in your life. Even if you're not going to become a sonographer,
Mhm.
you or someone you know will probably will or have or had have an ultrasound done.
Yeah.
So it's the first test that the doctor orders,
Mhm.
and it's it is a growing field if you're considering going into it. It is not easy money, as everyone says. And I've seen firsthand of people thinking that it is easy. You go in for the money. I've gotten questions asked about how much I'm getting paid, how much it is here in New York. Um, the pay varies. The pay is as expected as what Giselle says, but it varies depending on where you are. So do your research on that too, because what Giselle said is like an average amongst in the US. Obviously, New York's um, living costs varies from California, from Las Vegas, from Texas. So wherever you are, do your research on your programs. I know it's a lot to do. It's time consuming, but this is your future, your career we're talking about. So please do your research so that you don't, I don't want you to waste your time, you know, like I want you to, or we, Giselle and I want you to do your research so that you can get most of this career like we have.
Yeah, it's definitely a rewarding career, but
Mm-hmm.
it's challenging. And you
It
ask
is.
any sonographer out there, any student out there right now, they will tell you how hard it is. And no one's hiding it. No one's saying it's easy. It's out there for everyone and all to see. There is such thing as sonographer burnout, but there is such thing as burnout in any of the healthcare field because being in
Yes.
healthcare, it's very hard. It's an important thing for, the world to go around, for people to get taken care of. And we are part of the system that helps take care of other human beings. And um, if you listen to other episodes, you'll hear hard days, you'll hear good days. If you listen to the ones where we have guests, you'll hear their stories, what they did, what they wish they didn't do, what they had to go through. If you're a single parent, if you have, a family, if you are just single and looking for another career to go into, like this field is a good one for anyone as long as you put your mind to it, and you keep on pushing hard through your programs and your tests because I've seen it. Anyone that really wants to do it does it and they get through it. They find their program, they pass their classes, they scan. It's all different techniques. Scanning is really at the top of it, but scanning is not the only thing. There's so much more to it. And if you guys who are new here, stick around and listen to more episodes. You will learn so much more. And for those who are still here and have been listening to us from day one, thank you so much for listening. Lynn and I really do enjoy doing this, and we're hoping that the rest of 2023 uh, gives sonographers in the cities a whole new, I don't know, what do I say, facelift or something? Because we're gonna like We're gonna
We're gonna lift
do
it up.
we're gonna do more episodes and redo old ones, talk about new stuff, have new people on. Lynn is now a
Sonographers in the cities
sonographer.
is getting a facelift, everyone.
So, we appreciate everyone who's been here listening to every episode. And we see your comments, we see your reviews. We appreciate it all so much because we wouldn't be here doing this without you guys.
Yes, exactly what Giselle said. I think Giselle said, I'm like, what else can I say? But Giselle says everything.
Yeah.
Yes, I cannot wait. Giselle and I cannot wait to see what's in store for 2023 for sonographers in the cities.
Just tell them why you love ultrasound real quick.
Why do I love
Yeah.
I love ultrasound because this is my answer every single time. If you listen to previous episodes, it's still the same because you get to see everything inside the body real time. Like you're the only person who can do that because you're the one holding the probe and you have that control.
Yeah. That's very powerful. And people need to know that because like I said, that's a lot on your hands. That's a lot on your
That's
belt.
responsibility right there. Once you
Because
put your name on that report of what you're scanning, that's
all
you.
you. It's all you. No
Mm-hmm.
one's telling you what to do. You're doing it. I like that it's very like it's sonographer dependent. So
Yes.
what pictures you take, it's important. What you know, it's important because you describe what you see to the doctor. And what the doctor is looking at is either a still image or a video of an image that you took, and you have to explain what you're taking and why you're taking. Why is it significant? Why is it important? And it's just, I just love talking about it, like, because it just makes us so
Mm-hmm.
important. And it's such an important field that I think is really underestimated a lot of the times. Um,
Agreed.
and they always make this joke of like they put ultrasound technologists in the closet because it's just a machine and the patient, right? You
Mm-hmm.
don't have this fancy huge CT machine or MRI machine that you put these patients in. No, it's just you and the patient. Um, and it's a really great career field. Anything in radiology, anything in healthcare is a great career field, but this is our passion
Mm-hmm.
and what we truly feel like we're set out to do. So if you guys are interested, don't forget to add us on Instagram because we are here to help you guys and just really help you through your journeys so that hopefully one day you can become a sonographer too.
Yay. Because we love this community so much and we love seeing it grow. And for the past year, it has grown tremendously. So we cannot wait to see what the sonography community is like by the end of 2023.
Yeah. So if you guys need any more help or anything on Instagram, on YouTube, anywhere we're at, you can find all of the information and we're here to help you guys. And yeah, we can't wait to see what's in store. Hopefully, this episode helped you guys kind of figure out what sonography is. And we can't wait to hear more. If you guys have any questions, just let us know.
Thank you.
Thank you.
Thank you for connecting through sounds with us. We appreciate you and can't wait to connect with you again next time.